Hello everyone, welcome to our deep dive into anxiety disorders. How to identify, differentiate and treat them. Hi, I am Dr. Karim Khalladi, your clinical and sports psychologist and sleep specialist. Ready to get started? Let's get started. What is anxiety and anxiety disorders? So what's anxiety all about? It's our body's natural reaction to stress. A little bit of anxiety can be your best friend, helping you stay alert and focused. But when it goes overboard, that's where anxiety disorders come into play. We're talking excessive fear and worry about future events, muscle tension, and even avoiding situations just to keep those nerves in check. How anxiety disorders impact your daily life. Anxiety disorders can disrupt your life in the long term, with physical symptoms such as sleep disturbances and weakened immunity, impairing mental and emotional well-being, and straining interpersonal relationships. They impair sporting performance, school achievements, and productivity at work, leading to avoidance behavior and routine disruption. For an anxiety disorder to be diagnosed, the fear must be disproportionate to the situation and interfere with everyday life. Global anxiety disorder, statistics and the power of therapy. Check this out. In 2019, the World Health Organization reported that 301 million people around the world had an anxiety disorder, including 58 million kids and teens. If you're curious about how anxiety disorders affect athletes compared to the general population, there you have it. A systematic review in the same year found that combined anxiety disorders affect the general population at an estimated rate of 10.6% to 12% in the last 12 months, with similar rates in high-level athlete populations at 8.6%. However, therapy can help most people bounce back and lead productive lives. Understanding anxiety, phobias, panic attacks, fear, stress, and trauma. Alright, let's clear up some confusion. Anxiety, phobias, panic attacks, fear, stress, trauma, they're not all the same things. Let's break it down with some real-life examples and dive into what triggers each of them. First of all, anxiety. It's worrying about what might happen in the future. It's that nagging feeling that something could go wrong. Anxiety can manifest itself as temporary feelings, such as nervousness before an important presentation, called state anxiety, or as a general tendency to feel anxious in various situations, known as trait anxiety. Let's take a look at a few types of anxiety disorder. Generalized anxiety disorder, or GAID, involves constant, excessive worry about different aspects of life. Imagine worrying about your job performance all the time, even when you're doing great. Next, we have panic disorder. This one hits hard and fast with sudden, unexpected panic attacks. You might fear having a panic attack in public places, and that fear alone can be paralyzing. Agoraphobia is a phobia that results in severe fear or anxiety about public transportation, open or closed spaces such as lifts, queues, crowds, or being alone outdoors. People fear these situations because of the risk of panic or embarrassment. Then there's social anxiety disorder. where the fear of social situations is intense. Do you avoid being in public because you fear being judged? Yes, that's social anxiety. To differentiate agoraphobia from social anxiety, public spaces and feeling alone trigger agoraphobia, the fear of being trapped or of not being able to escape. Social anxiety, on the other hand, is the fear of being examined and judged because of social interaction. Specific phobia is marked by intense fear or anxiety about a particular object or situation. It could be anything from flying and heights to animals, injections, or even seeing blood. People with specific phobia either avoid these triggers or endure them with significant distress. Separation anxiety disorder is all about excessive fear of being apart from loved ones. Picture kids who can't bear to be away from their parents. Finally, selective mutism disorder, where a child talks at home but stays silent at school, illustrates this. However, fear is a natural reaction to immediate threats. Stress, on the other hand, is the way your body reacts to challenges. That high-pressure work. It can raise your stress level. Trauma is a bit different. It's about deeply distressing experiences that leave a lasting mark. Surviving a severe earthquake, that's acute trauma with long-lasting effects. Common symptoms of anxiety disorders. All these conditions share some common symptoms, like excessive worry, restlessness, fatigue, difficulty concentrating, irritability, sleep disturbance, muscle tension, physical symptoms such as heart palpitations, sweating, trembling, shortness of breath, nausea, dizziness, avoidance behavior, a feeling of imminent disaster, and hypervigilance. These symptoms can significantly impact daily life and functioning. If you or someone you know is experiencing these symptoms, seeking professional help is essential for effective management and treatment. Risk factors. All right, let's dig into what makes some people more likely to develop anxiety disorders. It's a combination of genetic, environmental, psychological, and developmental factors. Additionally, I will mention some other factors that may exacerbate anxiety. Genetic factors. Anxiety disorders can run in families. If your parent or sibling has one, your chances go up. It's all about those inherited traits. Environmental factors. Stressful and traumatic events can trigger anxiety disorders. Think childhood abuse, witnessing violence, or surviving a natural disaster. Your living conditions matter too. Growing up in an unsafe environment can make you more susceptible. Psychological factors. Certain personality traits, like negative thinking or being overly timid, can make you more prone to anxiety. Low self-esteem and poor coping skills don't help either. If you tend to see the glass as half empty, you might be more at risk. Developmental factors. Early childhood experiences are very important. Overprotective or controlling parents can interfere with your ability to adapt, leading to anxiety later on. Frequent changes or instability at home can also be a trigger. Biological factors, neurobiological imbalances in brain chemicals such as serotonin and dopamine are linked to anxiety. These imbalances can mess with your mood and anxiety levels. Behavioral factors. Avoidance behaviors such as avoiding anxiety, raising situations can worsen the situation. Substance abuse such as excess caffeine, cigarettes, or alcohol can also increase anxiety. Medical factors. Certain medical conditions, such as thyroid problems or heart conditions, can mimic or trigger anxiety symptoms. It's important to exclude them when diagnosing anxiety disorders. In general, symptoms required to diagnose an anxiety disorder take a minimum of 1 month for panic disorder, for example, and 6 months for other anxiety disorders. These timescales are essential for making an accurate diagnosis and differentiating between transient anxiety and chronic anxiety disorders. Let's dive into a real-life example. Meet Saif, a high-level athlete. When his brother was battling cancer, Saif experienced intense emotional stress. After his brother passed away, Saif started having panic attacks, feeling suffocated and fearing death. Therapy, including cognitive behavioral therapy, relaxation, breathing, and mindfulness exercises, along with family support, helped Saif get back on track. Today, he manages his anxiety very well and has a balanced life. Every patient's diagnosis and response to treatment is unique, so I'll provide a general overview of a few potential treatment plans. Treating anxiety disorders often requires a comprehensive approach. This includes therapy, such as cognitive behavioral therapy and exposure therapy, medication, lifestyle adjustments, and coping skills. Good sleep hygiene, a healthy diet, regular exercise, and mindfulness training are all essential. Coping skills such as deep breathing techniques, relaxation exercises, acceptance, forgiveness, and positive self-talk play an important role. Building resilience through regular physical activity, a balanced diet, and restorative sleep in line with your chronotype helps you to both adapt and recover from adversity. Limiting or eliminating excess caffeine and other harmful substances while exploring calming alternatives promotes relaxation and well-being. Thank you for joining us on this journey through anxiety disorders. If you or someone you know is struggling with anxiety, professional help can be a game changer. Stay informed, take care of your health, and remember, help